Good day, all, and welcome to the Teledyne Pulse podcast, your Rural Health Matters resource. Hear from your colleagues and industry experts on rural health issues and innovative care models that make a difference for rural hospitals, providers, and communities.
Hello and welcome back to the Teledyne Pulse. We are in episode 5 of our series on your digital strategy. And today, Shane, we're going to talk about technology, and that's kind of always my favorite spot to park. It's something I can kind of wrap my head around a little bit easier.
Yeah, well, it's a great topic. The funny thing is, it's a great topic, Andy, and it's of the conversations that we have with hospitals, it takes about 2 minutes of the conversation.
Yeah.
You know, it's we've always, as a turnkey solution, we've never made it about the technology. Right.
Yep.
It's always been about the providers. It's been about the process. It's been about taking great care of their patients with top-notch, high-quality providers in a timely fashion. And as a turnkey solution, we've always just said, we'll take care of that. We'll take care of that.
Yeah.
The technology for you doesn't have to be a concern. We'll handle that part. We'll manage it. We'll launch it. We'll support it. We'll update it, et cetera.
Yep.
So if you ever have an issue with it, you call us and we'll take care of it. So the technology conversations over the last 10 and a half years have been very limited for the most part. I mean, there's questions, of course, and I have sidebars with their IT divisions to talk through some things. But by and large, as part of a hospital that's contemplating these services, in my opinion, sometimes they get it backwards. And when an organization is trying to develop clarity around a program offering, it typically starts with technology. And, usually, and I'll give you an example. One of our early hospitals, I got a call from an IT individual, the director of IT, and this is, probably 9 years ago. He said, Shane, hey, listen, I just left a meeting with my CEO, and she said, hey, we're going to start some virtual programs. We're going to start a virtual hospitalist program. I'm going to send you to the ATA, and I want you to come back and tell me how to do it. And this he goes, I have no idea what to do, who to look for, what to talk to, what questions to I have no idea. I know nothing about this stuff. Now, granted, this was 8 years ago.
Right.
But that still holds true today for the most part. If you went to HIMSS or ATA or Vive or wherever you're going, I mean, you name it, right? The question oftentimes is, or not really a question, but more the statement is, I don't even know where to start on this vendor floor. I mean, what would I ask? Hey, I need to start a hospitalist program. Well, we sell carts.
Right.
And so what's that mean, right? So typically the IT individuals gravitate to what they know. And so before you know it, they're talking to all the tech vendors about the tech and the inside of the tech and what the tech does and tech. But what's really missing is the clarity around what they're trying to accomplish, other than what tech are we going to have. And I can't tell you how many times, and you know this, how many times we've come across organizations that have 4 or 5, 6 carts they got with a grant and have never been used.
Oh, yeah. They're in a closet collecting dust. They haven't been turned on in 4 years.
Right.
Yep.
Right. Or they're still in a box.
In some cases, early on, I remember opening a couple boxes.
Yes.
Yep.
Hey, can you use that stuff we got 3 years ago from that grant? Well, where is it? I don't know. See if so-and-so can find it.
Yeah.
And they did find it in the storage closet down in IT and they unboxed it right in front of us. Holy moly. That's pretty old stuff. So it's, and by the way, if your stuff is collecting dust and not being used, you're not providing any benefit to anybody.
Right.
So, and of course, that's preaching the choir here. But really, when it comes to technology today, I will say that it's shifting. The conversations are shifting today, and the rationale behind the technology is of importance. More important today than it was even 3, 4, 5 years ago. And I'll get into some reasons why. So we do spend more time on technology today in the discussions than we did, say, 3, 4 years ago. And really the reason for that is the evolution of the utilization of virtual technologies to deliver care in a hospital or any other setting for them. It could be LTAC, it could be SNF, could be any of them, right? And the question that really as we work through these strategy sessions with hospitals is really trying to figure out what's your program going to look like in 5 years, and what services are you going to be funneling through that system in 5 years. And they may not know the answers to all those questions, but really it gets back to really, if you go back and listen to until now, the first 4 phases of these, there's a lot to contemplate.
There is
when you're thinking about a virtual program. And most will say, well, we're not gonna think about most of that, so we're just gonna go one and see what happens, which is fine. But the question is, the expense you're gonna pay with technology and the platform you're gonna spend with technology, what is it? What do you really need to accomplish what you want to accomplish? And the reason I discussed this more in depth today than before is because of the evolution of the ancillary support mechanisms that we see today versus 5 years ago.
5 years ago, that was not as much of an issue.
Well, it really wasn't.
Yeah.
Telemedicine 5 years ago was a virtual physician encounter with a patient, by and large. And even back then, we had some challenges with some of our busier facilities where the carts were just too busy, and they had to, in some cases, hire an individual just to push the carts around all day long because the carts were so busy. And I get calls from physicians or somebody from our team would get calls from physicians saying, hey, I'm trying to get into this cart and nephrology's taking forever and they're doing their rounds and what's going on. So in busy programs, which, by the way, is great, that's our goal, is to keep these programs busy. You're not taking care of patients if these things are sitting idle.
Right.
And so how do we keep them busy? But the evolution of ancillary support services draws yet another variable. It's a significant one to consider as part of these projects. And so if you're a 15-bed rural hospital or a 25-bed rural hospital, critical access hospital, or you're a 200-bed rural regional facility or a 500-bed facility, the same questions need to apply in terms of where do you want to be in 5 years. And so that goes down all these different variables that we've already talked about over the last 4 phases. And ultimately, once we assimilate that information, you start to develop an idea of what you should use or need for a technical platform. And why this is important is because, in fact, we're working with an organization right now that has 5 different telemedicine programs that are operating. This is a 150-bed facility, and they're very frustrated. They're frustrated due to the variability in the services, the variability in the technology, and it's a mess. And so we're going to help them resolve all those issues and stack that technology into a single solution that really is what it should be today. And as you think about all those issues, for example, on throughput issues, and can virtual nursing make a big difference in there? We found it has in many instances. Well, if you start funneling nursing through that same system, and they're spending 40 minutes on a discharge education session and plan, those carts can't be used by anybody else until that's done. And if you're operating stroke neuro, of course, stroke needs to have their stuff immediately when you need that. So there's a lot of factors that start to enter the mix. And
so these ancillary services are really driving a change.
It's really, I agree. Mandatorily, yes, it is.
Yeah.
To answer your question, yes. Because the volume, you're looking at increasing your virtual volumes by several 100% at a minimum, maybe even 1,000%. On a day-to-day basis. And so you can either shift your technology thought process or strategy, or hire 3 people to push 15 carts around all day.
Right.
And man, that's a tough proposition. Seems in today's day and age that we can do something different.
Yes.
Right? And so the question is, how do we deploy in-room solution strategy where it's bolted to the wall and it doesn't leave that room, versus a mobile device that's rolling around room to room to room. And again, there's applications that's very appropriate. And then there's applications where it doesn't make as much sense.
Right.
And if you're thinking that down the road we may need to be doing virtual sitting, or we should be doing virtual sitting, or virtual nursing,
nursing, pharmacy.
We've seen pharmacists being, and by the way, you can do that, leveraging your own staff, your own pharmacist,
or remote pharmacy,
or a combination of both. We do that all the time.
Yep.
So it's important if you're thinking, golly, that'd be kind of nice to have even our own pharmacist, even from our own pharmacy bunker, just beam into all the rooms. That's way more efficient, right?
Yep.
Help facilitate that high-risk med discharge. The pharmacist has all the information they need right at their fingertips with the computers. Likely will make that education process better for that patient. We've actually seen improvement in satisfaction scores because of that.
Yeah.
So, but if the pharmacist is in there now doing that, after the nurse is done, or vice versa, now you're consuming an hour on that quote card.
Yep.
And so as you start to see that now, you're going to use case management through here as well. We're also going to funnel our language assistance through there, which we do all this. We're going to funnel this in. It's just the volumes are going to grow so much through your virtual platform that you really need to consider what should that look like long term for this organization, and plan for that, budget for it, and then when you're all said and done, you have the platform where it needs to be to then grow and scale your virtual program.
Yeah.
So I would say that's a primary reason why we spend a lot more time on Technology Day than we had in the past.
Yeah.
Primarily because there's just a need to do so. And we're a big advocate of trying to give hospitals as much information as possible to make the best decision they can. We're never going to drive them down a road that just because we think it makes sense for us or financially makes sense for us. That's not good. That's just not good business. And so, but what we do is try to encourage them to think outside the box and long term about the possibilities for their organization, what that looks like.
Yeah. And to your point earlier, the drive, the growth of and desire to provide more ancillary services really is shifting the technology answer.
Oh, it is, without a doubt. And I'll tell you, the advances have been spectacular. There's a lot of options out there, which, by the way, as you're pondering this too, as you're talking with technology vendors that are exclusively doing technology, there's a lot of questions you need to be asking them. And I get a lot of calls from CEOs that are pondering these types of things. In fact, CEOs we don't even do business with. Hey, I got a couple questions. What should we be asking for questions? Because I think it's important as you're trying to get as much information as you can about what platform you should be using. How can you leverage that? Because, again, it won't do you any good to outfit 150 rooms with a fancy system of some sort and it never get used.
Right.
That makes no sense.
Right.
And so you really want to have a great idea of how it's going to be used before you put it in.
Yeah.
And who's going to use it? How are they going to get access to it, and who's going to support it?
Yeah,
I mean,
all of those questions.
They're very important questions that really need to be answered long before you go and make a decision on a technical platform. Because you can, your IT person can come back from this conference that they just went to and say, we're doing X. This is going to be our technology. We're going to put in all of our rooms. Oh, that's great. Let's get it rolling. And they get it all put in. And then now what?
Yeah.
Well, I don't know. My job is to go find the technology. I got that done.
Got that done.
But
yeah. Which, to your point, when we started this conversation, we do bring a turnkey solution, and we are talking about the technology, and we are talking about support and maintenance and all the things that a small hospital might struggle with trying to do on their own.
That you for sure, and honestly, even large hospitals, we're finding more interest in large hospitals wanting this type of support, just because even with turnover, you have an organization that turns over their IT person who's heading this up, and then you're back to ground zero.
Right.
And it can really impact, you can, once these programs get integrated into the facility and woven into the day-to-day operations, and it really becomes a fabric of how they deliver care. It gets back to the Ivan Mitchell podcast here a few weeks ago about, listen, virtual or telemedicine is just medicine. It's been a part of our delivery model for so long. We don't even think of it as something unusual. Yeah, it's just part of what we do.
Yep.
Similarly, when you have this woven in, it's the very fabric of what you do on a day-to-day basis, and then it breaks for whatever reason, and you don't have anybody around that knows what's going on.
Right.
It becomes very difficult.
Yeah.
And it impacts care. And so it's those types of things to really ponder, and many organizations have built out robust teams that support this, do a great job. Others not so much. It just kind of depends.
Yeah,
for sure.
Yeah, but we are in that space and we live there. So
well, we like it or not,
yeah.
you're living in that space. But no, it is a significant and viable question to ask. Well, perfect. I think that pretty well covers the technology side of the equation for right now. We would like to thank you for joining us today. Our promise to you, the listener, you will be inspired or at a minimum find value in the information shared in this podcast. Please offer a comment or offer feedback so that we can improve this podcast and better meet your needs. Please remember to share this podcast with others that you feel may get value out of this by listening. And it's always helpful to subscribe to the podcast channel so that you're aware of future episodes and releases. In addition, if there is a rural health topic you would like to have covered on this podcast, please leave us a comment, or you can send an email to pulse@teledynehealth.com. That's pulse@teledigmhealth.com. For more information or general inquiries, please visit teledynehealth.com.